Hi, my name's Ashley and this is my lab pass-off. So I've pulled up a chart today and I see that Mona needs to get some medication, a baseline assessment, and a Foley catheter. So we're gonna go ahead and go to the bedroom, gather all of our supplies, then we'll head over to Mona's room and do all the things. So first things first, I don't see any hand sanitizer in the bedroom, so we'll find some. We're gonna do some hand hygiene. And I also don't see any regular gloves, so we'll grab some of those. Okay, so I pulled up the chart and we're gonna go ahead and take a look at Mona's order here, see what she needs. So I see that she needs guafenicin for a cough, 100 milligrams and 5 mLs, 100 milligrams, so she needs 5 mLs of this. Okay, and then a nursing consideration I can go over with her is guafenicin can cause you to be dizzy or a fall risk. So I'll go over that with her. It looks like she needs her lisinopril for her blood pressure, which is a med she's been getting before, so she's familiar with that. 20 milligrams. So she needs one of these tablets, okay. And then she needs ibuprofen for some pain, so that's 600 milligram. So she'll need 3 of these tablets. Alright, so I've gathered my meds. And then I also need to gather my supplies for the Foley catheter. So we're just gonna get this tray. When you're preparing meds for a patient, it's important to make sure that you do one patient at a time. You do the 3 checks, and then you verify this patient's 6 rates, which I'll do that when we get into the room with the patient. So we're gonna do gloves. We'll need sterile gloves for our Foley catheter. And I'm locking the med drawer now, so that is locked. Just want to make sure that we've got all of our supplies that we're going to need to do our cares today. So maybe grab some of these. Yeah, it should be in there. Okay. So I'm going to go ahead now, and now that this is locked up, I'm going to head to the patient's room. Knock, knock. Hi, my name's Ashley. I'm your nurse for today. Can you just tell me your name and date of birth, please? Thank you, Mona. I appreciate it. It looks like there's some medications that you're due for right now. We're going to give you your blood pressure, lisinopril med. You've had that before, is that right? Great. Mona, I see your name and date of birth match your armband. We're also going to go ahead and give you some cough medicine. I heard with this pneumonia you've had a bit of a cough. Have you had the guafenicin before? Okay, and you haven't had any issues? Great. So something we'll watch for is some dizziness or short of breath, just in case with that one. We'll follow up within 30 minutes of giving it to you and just keep an eye on you. And then also I hear that you have a little bit of pain, so we're going to do some ibuprofen for you today. Perfect. So I'm doing a safety check of the room. I've shut the door. I don't see any loose cords or anything like that. So we're going to go ahead and just get everything set up here. Let's go ahead and do your medication. Before we begin, can you tell me if you have any pain right now? You do? Just when you're coughing, you're sore? Okay, gotcha. And would you rate that on a scale of 0 to 10? Where are you at in that range? A 3? Okay, alright. The ibuprofen should help with that. Has this pain been just like all of a sudden, or how long has it been lasting for? Oh, just brief, okay. So it was just a brief new onset, okay. And is there anything that helps besides pain meds? Warm blanket, okay. And do you feel like the pain radiates through your body or just kind of stays in the same place? It stays in the same, okay. All right, well, we went over the steps of Caldera there for her pain and assessed that she's out of 3, so we'll move forward with that pain medication and make sure that that is documented. So we're gonna go ahead and just set everything up real quick here, Mona. All right, and to administer the meds, I'm just gonna get some gloves on. And we'll just do one at a time. So I checked the med when I pulled it out of the container. I checked it when I brought it to the room. And now that I'm dishing it up, and I'll check it one last time when I give it to you. I have verified that you're the right patient. These are the right doses. It is the right time for your medication, the right reason for your pain, cough, and blood pressure, and the right route as well. So we have verified your 6 patient rights today. So we're gonna go ahead and start with the guava phenicin. Again, she needs 100 milligrams, which is 5 mLs. Go back and try to get my computer to agree with me. Okay, well, my computer isn't giving me an option to click like a button that says administer, and I also apologize. I need to go grab a scanner from my computer real quick. So I am gonna call a nurse to bring one of those to me so that I don't leave these meds unattended. And I'm gonna look for the scanner, which we do not have a scanner, so we're gonna take a temporary pause and find one. All right, if you wanna just follow me, we'll go find Audrey real quick. If they must have taken it to the other room. Yeah, just keep it going. We don't have a scanner. Also, when I click on the med to administer it, there's not a button that says administer.
Why do you not have a scanner in here?
I don't know.
We don't know if they took it with them or what, but there's no scanner.
And there's not an option for me to administer it. I can click on it, but it doesn't give me the option to get it.
Scanner probably won't fix me. Do you need it for?
Yes. Should I just go through the motions of letting it scan?
Okay, and then what's the problem with it scanning?
So when I click on the name of the med, usually there's an option in the orders to administer. None of these say administer,
Can you click on the med itself?
but if I click on the medication, it doesn't take you to the normal page where it lets you scan.
Okay, refresh your DocuCare, like log out and log back in. And then if it still is giving you errors, go through the motions.
Yeah, it's not.
Are you on the right? You're on Mona,
She's
right?
the only Mona on there, yeah.
Well, we all know DocuCare's struggling today, so do your best.
Okay, I can just pretend like it's working.
Yes.
Okay.
Go through the motions.
All right. so I'm gonna go back into the patient's room, or I guess I never left. But I'm gonna do hand hygiene again just to be safe. And we're gonna throw some gloves on now that I've got my computer up and running. And I'm gonna start with your cough medicine. Okay, so just to confirm the name and the dose, guaifenesin, 100 milligrams, which is 5 mLs. So that is my second check. I'm gonna dish it up at eye level, 5 mLs. Lid back on, 5 mLs of guaifenesin. That is my third check. I've gone over my 6 rates, so I'm now okay to move forward and administer this to my patient. I'm just going to get you in a comfortable sitting position here so you can swallow this. Is that okay for you? Oh, good. Thank you. Okay. And then I'll just have you go ahead and swallow. Perfect. And here's some water to wash that down. Thank you. All right, so I can mark that I verified the time, date, medication, 3 checks, 6 rights for the guaifenesin, and mark it as administered. And now I can go ahead and administer or dish up her next one, which is her lisinopril blood pressure medication. Which she just needs 12.5 milligrams, which is 1 tablet. So I'll go ahead and get that dished up here. That was my second check. Okay, and doing my third check, 1 tablet, lisinopril, 12.5 milligrams. Perfect. All right, so this is your lisinopril, it's your blood pressure med. Here you go. Thank you. Perfect. Okay, and then I can go ahead and mark the lisinopril. I would have scanned her armband, scanned the medication, administered for all of these meds, but my scanner is not working. And now I can go ahead and do your ibuprofen, which would be the same thing. Scan the med, it verifies that it's the correct one. 600 milligrams, these are 200 milligram tablets. So I need 3 tablets, which three tablets, ibuprofen. So that would have scanned, verified. That's my third check. Here's your meds. Here's this. Perfect. Okay, all 3 meds have been administered, and in the DocuCare system I have marked them as administered as well. I can then go ahead and these will need to be taken back to the med room to be locked up. But we're going to go ahead and move forward with the rest of her baseline assessment and then her Foley catheter. So, all right, would you like to remain sitting, or do you want to lay back a little bit? That's good for you? Perfect, sounds good. So we're going to go ahead and start with your eyes. Is that okay? Great. So with your eyes, go ahead and close them. Open. Open. Great, thank you. And then just go ahead and follow this with your eyes. Okay, your pupils are round, reactive, and responsive to light and accommodation. We call that perla. I'm just going to go ahead and briefly touch your head here. Is that okay? Let me know if you have any pain. Nothing. I don't see any redness under your oxygen tubing or anything. Everything looks great there. Which I did verify your oxygen is on the right dose as well, so that's great. And then we're going to go ahead and just look in your ears. This one. Thank you. And then we'll look in your nose. looks great. I don't notice any abnormalities. I did see on the record that you're oriented ×3. You know where we are today. Great. And next, we're gonna go ahead and just move down to your chest. Is it okay if I listen to your heart? Perfect, okay. I'll go ahead and do that next then. Thank you. I don't see any struggling for breath right now. I don't see any stridor or abnormal markings on the skin or anything like that. So just go ahead and listen to the heart. Aortic, pulmonic, herbs, tricuspid, and the mitral. Now your mitral I will need to listen to for 1 minute. It is the primary place that we like to listen to. Okay, now we're going to pretend that 1 minute has passed, and that sounded great. Everything sounds good. So we're going to go ahead now and move to your lungs, and I'll just listen to those in the front, and then I'll have you lean forward and we'll listen to the back. Is that okay? Okay, great. Take a deep breath. Another. 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 Okay, thank you. And we'll just have you sit forward here. Now take a deep breath. I do see when you're breathing that your breathing in is equal. Rise and fall looks good. So we'll just have you breathe in. Breathe in. Breathe. 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 Great. I do hear a little bit of crackling in there. That's probably due to your pneumonia, but we've got you on some meds, so I'm glad that that is going to help that get better for you. So next, after looking at your skin on the chest and on your back, I don't see any abnormalities or redness or anything. I'd like to go ahead and assess your stomach. Is that okay? Great. And would you like to recline a little? Okay, perfect. Also, when I came in and did my safety checks with the tubing and everything, I did notice that the bedwells were locked and bed rails are up. So we're gonna go ahead and just look at your stomach here really quick, okay? And we'll listen to it first. Do you have any pain in your abdomen that we should know about? No? Okay. 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 Great, thank you. I do hear active bowel sounds, so that's perfect. And I'll go ahead and palpate now if that's okay. Any pain there? How about here? Any pain? Any pain? Perfect, I don't see any redness, bumps, anything like that. No pain was present, no lumps or bumps, so perfect. So we'll go ahead and just move on to your skin. I do see that in this arm you have an IV, which after looking at it here, I don't see any redness or inflammation. It looks good. Is it hurting you at all? No? Perfect. The rest of your skin does look great as well. We'll go ahead and assess this arm as well. Everything looks great. I don't see any edema. Radial pulses are strong. Let's do your capillary refills. Great. They are strong as well. Less than 3 seconds, so that's perfect. Excuse me. All right, so I've assessed your skin. So now we'll go ahead and just ask a few questions with your bowels. When was your last bowel movement? earlier, okay? And you're having some pain with your retention with your urine, is that right? Okay, and would you say that it's like burning? Yeah, just uncomfortable, okay. That catheter is really gonna help us out for that, so we'll get going on that next after I go ahead and assess your lower half here. Can you tell me with your meals, are you eating like 50% or 100% of them? Most of it, good. I'm glad to hear it. Looking at your skin, I don't see any pitting or edema. Everything looks good there. Let's just go ahead and check this one. Okay, this one is also looking great. Perfect, we'll check your pulses here. Those are strong as well, cap refills. Perfect. Okay, go ahead and just push against my hands. Thank you, and just go ahead and pull back. Good, okay. All right, and then we can go ahead now. I can't talk, my voice is going away, I'm sorry. We can go ahead now and finish off the assessment here so that we can get your catheter in place, okay? Thank you so much for being patient through that process. Okay, so we performed hand hygiene and we're gonna go ahead and just get the area set up for your catheter. In order to do that, I'm gonna raise your bed to a comfortable working height, okay? And it will just be a minute while I set up my supplies. I'm gonna pull this down, is that okay? Thank you so much. Okay. There's already a chuck placed underneath you, which is great. We're gonna go ahead and just make sure everything gives us enough room. So we're gonna go ahead and put on some gloves. Okay, so we're just gonna clean a little bit, okay? So out a new area of the wipe, or you can get a new wipe. If it's called for or needed, you can do some rectum care as well, but everything looks good there. So now I'm gonna go ahead and just get everything else set up. There's a lot of steps involved, so we'll just try to go through this together and do our best. I like to use this bag as a trash bag. So we're just gonna place it there, okay? Thank you. And we're gonna go ahead and there's my sticker to label. So I'm gonna put my initials and today's date. We'll put that on the bag once it's installed. So next we're gonna go ahead and get our kit open up. Okay, I'm trying to think of what I want to do. Let's get the kit open up. So we're gonna go ahead and just keep our hands on the 1-inch border. Hopefully opening it away from ourselves. Okay, and then there are some sterile gloves in here that you can use, but I've got a packet of mine, so I'm gonna go ahead and use those. So you just roll it each border. Okay. a little bit slick. Okay. And then with this one, we'll grab it here. By the cuff edge, if you can see that. Okay, now that my gloves are on, I can fix them. Okay, make sure everything is good. All right, and then I'm gonna keep my hands up because they are now sterile. So we can go ahead and continue to set everything here up. So we've got our drape. You want to be careful not to shake it. And put this on. And if at any time you break sterile filled, you would start over. Okay, and then you've got these, which are extra. Cleaners. We only need about 5 mL of this. So we're just gonna get that ready. And then we're gonna just make sure that we're not like blocking our way with everything, so. We also have, oh, there it is. It's hiding. Lubrication. Okay, and then we included another label for your collection tube if needed. So we'll go ahead now and just get this set up. You want to be careful that it doesn't flop around and become unsterile. So. Like that. You gotta keep it in your hand. And if it had touched something, I would have gotten a new one. So we'll just get that ready in there. Okay. And then this part connected. All right, so now we can go ahead and clean. So we're gonna put these, let's see, let's move our tray first. So without touching the outside of the box, you have your tray in place, okay? Now this hand is going to become dirty. Outside. Outside, you want to make sure that it does not close or it becomes not sterile and you need to start again. Inside. Okay. Alright, so I'm done with that. So I can go ahead and get my lubricated tube here. Insert it until I see a flashback. Just breathe, you're doing great. Good, okay, I see that. So now I'm gonna go ahead and inflate the balloon. Making sure anytime if you feel concerned that it doesn't come out, it feels good and secure in there. Go ahead now, and our kits did not come with a option to secure it to the leg. So what I'll go ahead and do now is clean everything up, secure it to the leg, and go from there. So you want to do it at like a comfortable distance. You'd also do some skin prep as well. So I'm going to go ahead and just get this stuff taken care of so that we can get it attached to her correctly without any issues. Do some hand hygiene. And then make sure if you got any like lubrication or pee that you would clean that up. This here to her leg. You would attach it after you do skin prep. You would then take the bag and you would attach it to the non-movable portion of the bed frame. So you would specifically look for this metal hook right here, and it's attached, it's not on your bed frame. And then now that it's secure, I can go ahead and clean her up. It looks like everything's fine. She didn't need to be cleaned. Get you comfortable. Throw my supplies away. And then we're gonna go ahead and get you back down to a safe position. Yeah, you did good. That should allow quite a bit of relief, huh? And then our order did not call for a specimen collection, but you would collect off of your brand new bag if there was an order for one. So you could go ahead and do that. And then we'll just get you nice and tucked up here. It's important that you label the bag so that they know when it was put in and changed. So that's where this label comes in with your initials and the date that it was given. So you just peel that, stick it on your bag. Okay, and then at this point, is there anything else that I can get for you? No? Okay. So we did your assessment. I'll go ahead and document those findings. I'll document that we administered your 3 medications today, and I'll document that we entered that Foley catheter using the 5 mLs of saline in the balloon. We'll go ahead and check back on you within 30 minutes or so. Make sure you're not having any side effects from those medications. And right now I'll go ahead and just clean up the room and then go lock my medications back in the supply cabinet. So we just want to make sure we get it cleaned up in here so it's not a tripping hazard or anything for her. And then you have a great day, Mona. Thank you for letting me visit. Leave supply closet, lock up the meds.